Hello, and welcome to a very special conversation. As a nonprofit entity, KidsPeace's operations are overseen by a national board of directors, a group of volunteers. To talk about that group and its activities, we're very pleased to welcome Dr. Scott Reines. Dr. Reines is a physician and a leader in pharmaceutical research and development, first with Merck, and later as a senior vice president at Johnson & Johnson, where he led teams in developing new treatments for patients with autism, schizophrenia, bipolar disorder, and Alzheimer's disease. With a medical degree from Albert Einstein College of Medicine, he is board certified in Psychiatry and Neurology and consults for various entities in the areas of biotech and pharmaceuticals. His volunteer efforts, in addition to his work at KidsPeace, include serving on the National Drug Abuse Advisory Council and on the board of directors of Heritage Conservancy, an organization devoted to land preservation. Dr. Reines joined the KidsPeace board in 2010. He currently serves as its chairman. Dr. Reines, thanks for being with us.
Thank you. It's great to be here.
Now, I'd like to start our conversation today talking a little bit about your early days and your career, how it evolved, and then how your involvement with KidsPeace evolved. What were some of the factors that led you to focus on mental health as in your work and in your service on the board?
Well, during my medical training, I became very interested in working with people who had emotional disorders, mental illness, behavioral problems. At that time, I'd already completed my doctoral work in biochemistry, and so I realized that those interests could combine to support a career in clinical research in which I'd focus on treatments, understanding of mental illness, as well as the development of treatments for them. And I should say back in those days, the treatment options were fairly limited. Mm-hmm. Understanding was much less than it is now. And so it seemed like there was a great opportunity to help in that way.
Now, that's a very good point. That I think a lot of people forget is that we've seen these incredible advancements in treatment, first of all, in understanding what these conditions are and then ways to address them. What are some of the major changes that come to mind right away with you in terms of the treatment of mental and behavioral health conditions and what's changed over your career?
Well, let me say that following your comment, the science and understanding of the brain and how it works has really progressed in the past, let's say, 40, 50 years. The treatment options have progressed as well and have been refined. I wouldn't say there's been a breakthrough the way there has been in some areas, such as cancer treatment, but we're much better able now to make diagnoses and prescribe drugs and treatment modalities that are more targeted for the specific patient.
And I think that is a really interesting analogy you make, as we talk about the physical health issues and how it's more understanding allow us to get more in tune with what those targeted treatments can do. And we've seen that in physical health, we've seen it in mental and behavioral health as well. Shifting and talking about a board of directors, what it does. I've noticed as I talk to people, most folks understand what a board of directors does for a for-profit company. They understand that it's basically to represent the interests of stockholders, which are the company's legal owners. But there's always some confusion as I talk to people about how that translates to a nonprofit organization. How do you see the board's role in terms of governance at an organization like KidsPeace?
Right, as you say, it's very different from a for-profit in the sense that the KidsPeace board is all about the mission of KidsPeace, and our job is to ensure that the mission is being carried out. It's not to ensure shareholder profit, because of course we don't have shareholders. On the other hand, we have to have financial stability. So in that sense, there's some similarity to for-profit boards. But really what it comes down to is that our role is to ensure that we're on track, we're delivering according to our mission, and that we're refining our mission as the field, as the world evolves.
So the mission is really preeminent, whereas maybe in a for-profit company, they have rules that say, we have to defend shareholder value or something like that. For a nonprofit, it's really about, are you fulfilling the mission that is at the core of why you exist?
Exactly. And if we're not doing that, the board has failed.
I should point out that in addition to your generosity of time on our board, you and your family have been also very generous in terms of resources. Among the projects that you and your family have donated to, the establishment of the sensory-friendly playground at their Graham Lake campus, establishing a computer laboratory for our education programs at the Donnelly Tech on the Orchard Hills campus, filling the gap in funding for the renovation project at our Green Street offices in Allentown, which is a combination with the Trexler Trust, and that's going to allow us to serve literally hundreds of additional clients in the Lehigh Valley over the years. So first of all, thank you so much on behalf of us and all of our clients for that. But it leads me to my next question, which is, in your view, what is the role of the board when it comes to fundraising for an organization?
So let me, and thank you for those comments. Let me talk a little bit about my sort of personal evolution in this area. My wife and I have always been as generous as we can be with supporting the kinds of organizations that we value. But I have to say, when I joined the KidsPeace Board of Directors, my total experience had been working for large companies, and then working as a paid consultant. And so with KidsPeace, I was giving my time, and I guess I was a little surprised that then, and this may be just me, but I hadn't really thought about, well, what about a financial contribution? Because I thought, well, I'm contributing my time, and hopefully that's valuable. And
it absolutely is. I want to make that clear.
No, I thank you for that. But I realized as I sort of got more comfortable with the organization and the board and how things work out, that it's incredibly important for board members to show their support for KidsPeace, not only in contributing their time, but in contributing financially as much as we can. And that's for several reasons. One, of course, it benefits the organization to have as much financial support as we can give. But also, as leaders of the organization, we need to demonstrate that we're committed to the organization financially. If we're not, why should donors then commit to this organization? If they look and say, well, your board is sort of detached when it comes to that sort of thing. So I realized as things evolved that this was an extremely important activity. And the other thing is that as a board member, you see what needs to be done. You see where there may be some gaps. Like the playground in Maine, that contribution came because my wife and I were there. We have the Autism Residential Center there. And she had a great conversation with the director, and she actually said to me after that, because they had talked about how the playground was sort of stalled, she said, we should try to jumpstart this. Let's contribute. And so we knew where there was a need, and we were really happy to fill it.
Well, again, thank you so much for that. Another question that comes up when you talk about folks being on boards, it goes to the point you made about the time commitment. Is it necessary to have a significant commitment of time when you're serving on a board of a national organization like KidsPeace? It
is. The board, of course, is not a full-time job, and some of our board members still have full-time jobs. I have my consulting work, but the board can be a significant time commitment. For instance, recently we had a nationwide search process to find a replacement for Will Eisman, our retiring president and CEO. And most of the board was on the search committee, in fact, and that involved a lot of time interviewing candidates, discussing them afterwards, talking back and forth about who we should bring for the next round, and ultimately making that decision. So that was a pretty intense commitment. Other types of commitments we've had in the past have been when the company, the organization has had financial difficulties in the past, which fortunately are behind us now. But we went through a lot of issues dealing with how to right the financial ship of this organization. And that took a lot of board member time. We're also working on a strategic planning exercise right now. And then we have our ongoing board meetings at which we expect full board attendance, as well as participation in committees such as the financial committee. And we have several other committees that work with the senior staff here, try to provide advice, counsel, and input into our ongoing work.
You mentioned the strategic plan, which, as we're talking, is being developed, combination of board members and management personnel working on that. How successful is that effort, or I should say, how important is that effort to the long-term success of the organization?
Well, it's critical that we be successful in that activity. And the strategic plan is something that's a living document that we continue to refine every few months as we move forward. But every 3 years, we try to step back and say, okay, let's develop a new plan now. The world changes so quickly, especially the healthcare world, that, and we're in it, and especially the people who are on Mike Slack's executive team.
Right.
They're in it doing the work, which makes it very hard sometimes to step back and say, okay, are we doing the work as efficiently as possible? What are we missing? Are there opportunities that we're missing? Are there places where the world has changed, so we need to refine or consolidate what we're doing? And so it's critical that at these intervals we take a look and sort of reset as we need to, redefine our goals and move forward, hopefully in the most efficient way.
It's, as you describe that, I realize you really are talking about sort of the best sort of case scenario for how a board and an organization should work together. The organization, those people are going to be in the thick of it. They're going to be in the trenches working on these things. And as you said, they need someone to help them sort of pull their perspectives back and see maybe see the bigger picture, maybe see other things going down the way, which is where the board in this dynamic are the people who need to do that.
Yes, that's the opportunity we have as a board, since we're not in the trenches every day. And hopefully we're staying alert, we're getting the inputs and communicating them in real time, but also trying to piece things together for this exercise where we can stop and say, what else do we need to do, or how else should we be doing it?
Right now in this exercise, and this is a 3-year time frame that you're looking out on, what are a couple of what you see as the major challenges that the organization will face in that time frame, and how do you see the board addressing those challenges?
Well, I'll put the challenges into two groups. One, the ones that we can see, maybe with the help of consultants or with all of us thinking together, we can see certain things. Then there are other challenges that we know will occur that we just aren't seeing at this point. They're unpredictable. So in terms of what we can foresee, we know that the healthcare field is going to continue to evolve. Regulations are going to continue to evolve and probably become more and more restrictive. At the same time, the regulations don't come with their own funding sources. And so we know that healthcare delivery is going to become more expensive. Funding is probably not going to increase. So how do we become more efficient? For instance, in the way we've recently implemented electronic healthcare records, what else can we do to keep up with the need for financial stability while we're providing the best possible service? So we know that the state governments will change, the way they view mental health care will change. There's continuing shift from residential and inpatient care to outpatient care, and we have to be aware of those trends and see how we can help to stay on top and deliver the best possible care.
Okay.
Then I should say the unknown challenges, of course, which I don't know. We've had just things that happen to us where there might be a regulatory body that suddenly comes in and says, you need to spend $1 million upgrading your facilities. We didn't know that was going to happen. So what we're trying to do in that sense is being prepared, having enough human resources, having enough financial resources that we can weather a storm like that, and we can continue our operations while we're dealing with that.
I think when people are talking about organizational planning, they tend to think, well, you need to be able to foresee every possible thing of impact that comes in. And I think as your board is doing, as the folks here at KidsPeace are working with them, it seems like it's a much more nuanced kind of event, or maybe a much more sophisticated look, which is say, yes, we're going to try to oversee or foresee everything and be ready for those, but the idea is to try to make sure you're prepared for those so that when the thing comes in that you haven't foreseen, you have the personal resources, the financial resources, the facilities, whatever, to be able to handle that surprise.
Yes. And one thing which connects back to the question of fundraising is that the board, I'd say a couple of years ago, realized that we're not primarily a fundraising board. I mean, we did know that, but we also realized that we needed to have a group that was primarily, exclusively really, a fundraising group for this organization. So we created the KidsPeace Foundation, which is led by the head of development at KidsPeace, as well as one of our board members. And it includes donors, several other board members. And so that group is trying to provide a financial cushion, maybe someday create an endowment, so we can really get ahead of the curve and have that kind of backstop of resources when we need it.
You have served on the board of KidsPeace for the better part of a decade. And I'm wondering, I'm sure you get this question. I'm wondering how you answer it. How do you answer the question, what is KidsPeace and why is it important?
It is. I do get this question, and because not a lot of people don't understand our organization, they don't recognize our organization. I'd say in the simplest terms at its best, KidsPeace is a refuge for individuals, primarily children, of course, who may be in crisis, but who certainly have emotional needs, who may have behavioral problems, who don't know how to cope with what they're experiencing. It may be due to mental illness, it may be due to family problems, or usually a combination of the above. And KidsPeace is the place where they can come. KidsPeace is foster care. KidsPeace is residential care. We are acute inpatient care, outpatient care. We have some drug and rehabilitation services. We're all those things for the people who need us.
Okay. That's very, very concise, very solid explanation. Our final question today. You are a very busy man. You're very busy with your consulting work, and obviously you're donating a lot of time and effort here at KidsPeace and your other volunteer efforts. I have to ask, what do you do for fun?
Well, my wife and I have 8 grandchildren, and spending time with them and with their families is really our greatest source of joy. We love to travel as well. We're just back from a fascinating trip to Sicily and Malta.
Oh, okay.
Where we got delayed by an active volcano. Had trouble getting home, but we made it. We've explored many parts of the world, mostly on foot, because we love hiking. We love guided hiking particularly, and exploring, getting closer to wherever we happen to be. I like participating in sports, particularly tennis, ping pong. I like swimming, and I try to do that for exercise as much as I can.
That's wonderful. And congratulations on the 8 grandchildren. That must be a little bit of wonderful chaos sometimes. Dr. Scott Reines is chair of the KidsPeace National Board of Directors. Dr. Reines, thank you so much for talking with us today. Really appreciate your time.
Thank you.
And thank you for joining us as well. Providing hope, help, and healing to children, adults, and those who love them, this is KidsPeace.